Thank to be present here, the last session, the last talk. Only to remind that we talk about profile, we need to put the focus in some difference between male and female. Here is the same image of a person that we put in a female projection and a male projection, and to remind you that some points that we need to care about that. The position of the eyebrow is more lower and thicker in the male, in more upper and with a curved position in the female. The eyes is more round shape in the female, more thinner in the male. The malar area more projection in female. The zygoma width is better, is bigger in male, at the same time in the gonian. And the position of the chin is more square shape in male and triangle way in female. The final shape is like this: trapezoid position and triangle, and two rectangular on the male. Some anatomic concept to remind you, only for that. We have 4 stations: the buccal, pterygoid, pterygopalatine, and temporal. We need to look for only for this one. Let me put the, I don't have that, okay. Okay, always only put the focus on the buccal part, in the anterior part or the masseter muscle. Only that. Don't try to look for other part, because you reshape a lot the face and create a cadaveric form. The amount is equal like a thumb, only 5 millimeters. Who is the best candidate? This. The chubby face, the fat cheeks, the convex area. That's why we need to reshape this face to round to triangle way. And who is the worst candidate? People like this: low BMA and high BMA, less than 18 and over 30, because in the first one, again, you obtain a cadaveric shape, and in the second part, in the second option, you and your patient never going to see the result. And of course, any kind of patient with overweight expectation, you need to lose these kind of patients. Here the example: change the round shape to the triangle face. And I love this kind of position when you try to obtain the best view of the result, because it's the way the cheeks go down, fall down, and you obtain the better shape of your result, the better view of your result. The classical risks that are associated with bichectomy: trismus, bleeding, infection, persistent edema, hematoma, sensatory disturbance, prolonged pain, asymmetrical faces appearance, because you take in some cases more than one part of the other, or in some cases you increase the asymmetry of the normal symmetry of any kind of facial or any kind of people. But I put the focus in this one because you need to avoid that, are very difficult, and in some cases are forever. The position here, very clear in the CT, is forward in the anterior position with the masseter fibers. When you have these vertical fibers in the masseter, you need to go forward that, and you're never going to have any problem to find the buccal fat pad. Just in this case, this is the way you need to put the scissor, always back to up, and you always can find it without any problem. The classical appointment, I try to show the patient the appearance of the buccal fat pad, because always when you push it, it appears here in the inner mucosa of the buccal area. And I always try to identify the ductus of the sternum duct. Not always is so easy. That's why in some cases I need to squeeze the parotid glands to be sure leaking the saliva, and be sure the position to avoid any kind of injuries. I love this maneuver, the kiss maneuver, because I look the patient. I ask to the patient to see herself in the mirror, and this is the amount of my result, close to that. If he agree with that, I process with the surgery. If he think it's not good enough, it's not the patient for mine. And I do it again, the same, in the surgery room. I ask for the kiss maneuver. And after that, I ask for a big bit. And that's why I have a contraction of the masseter. And in the anterior position, forward that, I mark to be sure this is the area that I want to treat. And of course, usually I combine with another procedure, like in this case, a liposuction of the submental area. Here is during the procedure. It's really important to make it easy, step by step. First, a great hydrodissection with 2% infiltration. In this way, you put the buccal fat really close to the wall of the mucosa. You need to open only 1 centimeter. And this is another important part. You only need to dissect with the scissor, never cut, and it's easy. The buccal fat part appear. As I said, I only take out the buccal fat part, not go to the pterygoid or other part of this buccal fat part, because you can take anything you want, but you can reshape a lot this face. I love to look for the pedicle and cauterize it after I cut it. And I put 2 or 3 stitches to close the wound. Some result, when we mentioned only bichectomy alone, this is part of my result. Another one in a half profile view. In male, it's difficult to see the result by the bar, but you can measure here and here the depression. Again, here is the depression and the change of the one face. Again, one face to triangle face. Better view when you use this position. And when I take out the color of the photo, you can measure better well in a half profile view too. The last case, I suppose, here is the depression, round to triangle. Another case. And when I combine it, I usually combine it with liposuction of the submental area. I use diode laser. I use ultrasound cavitation. I add, in some cases, volume with chin augmentation by implants, synthetic filler, or fatty filler. In some cases, I obtain the resection of the bone, especially in the gonial area. And in some cases, it's part of my solution for malformation asymmetry treatment. I start with this one, not only bichectomy, at the same time chin implant. And you can see here a great change of the shape of this female in another profile. And here is the color of the change of the volume in the vector system. We add volume, we take out the volume. One face, 2 checks, 2 triangle.
30 seconds, please.
1 minute? Okay.
30 seconds.
Huh? Seconds, okay. 20 seconds. Okay, it's good. 30, okay. Another great case here is worst cases, better result. You can see the great change in the profile. In the profile again. And here is when I take out the gonial area during the procedure, during the resect of the bone. When I take out the buccal fat pad, the amount of the buccal fat pad you can see here is like a thumb, no more than that. And here is the reshape of this face in the male to change to female. And when I use it in a microsomy with left cheek fatty tissue defect, poor left gonial projection, chin prosthesis, displacement, excess fatty right cheek, right submental fatty excess, and mamelon. And this is the way I change complete this patient, not only to adding fat in this area, at the same time take the buccal fat pad and make the liposuction on the right side. And here is the proof that they are done. Here is the increase of the volume and the reduction of the volume. Over indication, my mistake, I think that she's a model, but I think it's too much. I add a filler on the malar area, and here is the bichectomy. And here's the proof, the addition of the volume and the resection of the volume. A complication, vascular injury, bleeding and bruising, asymmetry in some cases. I need to abandon the procedure in some cases. Take-home message, just in the finish of my presentation, easy and safe procedure in the hands of any kind of plastic surgeon. A low complication rate, single or combined procedure. Avoid extremely high or low BMA. Avoid complication in case of anatomical or technical doubt. Please abort the procedure. If you or your patient regret the result, remember the article of Steve Cohen. You can reshape with the lipofilm. Thanks so much.
Thank you very much.